Are you aware of the mental health situation in Hong Kong? Mental health problem is a significant public health concern in Hong Kong. The Mental Health Report in 2017 revealed that the prevalence of common mental disorder among Chinese adults aged from 16 to 75 was 13.3%. The most common one was mixed anxiety and depressive disorder. 4.8% of the general public aged between 18 and 64 is diagnosed with severe, nonspecific psychological distress. The demand for hospital authorities' services has been on the rise, as evident in the increase in the number of patients with mental illness under its care. Indeed, stress is one of the significant factors contributing to the mental disorder. Most citizens are suffering from anxiety, even if they have not reported to the hospital. We know little about it, and even sometimes negatively label it as a monster. Stress is the state of an organism when reacting to challenging new circumstances. It may be from an unexpected or challenging event in the environment, but the stressful event requires readjustment. Thoughts, feelings, behaviors, and physiological reactions are all involved. And the stressor is the stimulus that produces feelings of tension. For example, we may feel very stressful when we need to catch the deadline that is 1 hour later because we have not yet begun. The stressor is that deadline in this condition. A great variety of environmental conditions, both positive and negative, can produce stress. But we need to notice that different individuals respond to the same situations in different ways. For example, in response to the challenge of a job, some workers experience stress severely, while others can easily tolerate the same event. The perception may depend on the physiological and psychological state of the person. For example, consider that time that you are doing your term paper. The term paper deadline might be dealt with straightforwardly by the individual when feeling well, but may produce severe stress when you have already been exhausted, depressed, lonely, or suffering from a virus. Stress has been conceptualized as a stimulus, as a response, and as processes. Celia postulated that stress is a stimulus that triggered the feelings of tension, with physical and psychological responses to the life challenges. In this view, stress may be internal feelings or somatic reactions generated in response to events or situations. We can use one example to illustrate the difference between these two conceptualizations. For instance, a man called Rolando and his wife just had twin babies, and their life changed dramatically. He now has more responsibilities in the family, and at the same time, he has less time to sleep. According to the first conceptualization, he is experiencing the stress, while according to the second conceptualization, the issue of whether Rolando and his experiencing stress depends on several other factors, such as how he feels about his new responsibilities as a father, or the increasing financial burden. His response to the change in his life, not the changes themselves, are more critical. Lazarus saw both of the previous approaches as valuable but inadequate, and chose to treat stress as a process, involving the interaction between the person and his or her environment. The degree of stress depends on how it fits between the individual and his or her environment. What a person thinks about the demands of the situation and personal abilities to meet those demands are critically important. What triggers stress? Early research on stress focused on identifying life events, or stressors, that required people to adapt to change, tolerate some discomfort, or deal with some threats. Researchers can then evaluate whether people who face more stressors experience worse health. They formed 3 categorizations, namely daily hassles or uplifts, life events, and cataclysmic events. The major life events include both negative events, such as getting divorced, being fired from one's job, experiencing the death of significant others, and positive events, such as getting married, having a baby. Different to those major life events, daily hassles and uplifts are relatively minor events arising out of day-to-day living. Some researchers have argued that many stressors come not from the major life events, but instead from daily hassles. These more typical types of stressful daily hassles, such as losing the key or catching a traffic jam. Both daily hassles are strong predictors of both psychological and physical well-being. More importantly, hassles caused more mental and physical symptoms, even than the major life events. Why? Because of its frequency. Annoyances happen more often in our daily life, and its effects accumulates. Stress affects everyone. On the positive side, stress is a necessary part of the psychological growth and change of an individual. A certain amount of pressure can help to keep a person alert and interested in life. However, the amount of readjustment demanded by the modern life is so excessive that the person's level of stress is overwhelming. Although many observations suggest that stress may lead to illness, this does not always occur. We all meet the challenge, but many people remain healthy. What is the relationship between stress and disease? What happens to our body when we face pressure? In a serious condition, we may suffer from illness triggered by the stress. There are two kinds of illnesses. One is the acute condition, the other is the chronic condition. Acute conditions are more debilitating and require more care, such as appendicitis, acute leukemia, and strep throat. While the chronic one is a long-term, often permanent, and leaves a residual disability. Some common chronic illnesses are heart diseases, stroke arthritis, and the like. The Hong Kong government conducted periodical surveys to see the physical health condition in 2015. Overall, 57% of the people aged 15 or above reported that they had acute health problems during the 30 days preceding the survey. Females were more likely to have such problems than males. Common cold/influenza, joint pains and swollen joints, low back pain, persistent cough, and neck pain were the 5 most frequently reported acute health problems encountered by the Hong Kong population. Some acute conditions were more common in older age groups, or exhibited an increasing trend with age. The government also collected information on the chronic health conditions that were diagnosed in the 12 months preceding survey. Overall, 39.6% of people aged 15 or above reported one or more doctor-diagnosed chronic condition. Among these people, 20.1% had one or more chronic conditions first diagnosed within the 12 months before the survey. Hypertension is the main type of chronic disease in Hong Kong. We often think that intensive stress may lead to illness, but we seldom study its underlying mechanisms. Mori and her colleagues studied the relationship between stress, immune system, and disease. Stress induces chronic immune activation and altered health outcomes. Altered immune functions can lead to exacerbated symptoms of both physical and psychological illnesses. Stressors occurring early, i.e. from the childhood and adolescence, and late, i.e. from the aging, in the lifespan have suggested that individuals exposed to chronic stressors can exhibit immune dysregulation. Stress and coping processes change across the lifespan, require life wisdom to understand the change, and then get growth. Some evidence suggests that older adults use mature coping strategies and are better at emotion regulation than young or middle adults, and their problem-focused coping increases in specificity and effectiveness. A general model of stress and illness combines 3 different explanatory models as a comprehensive pathway. The first part of it is the illness behavior or sick role model, established by Mechanic in 1968. This model suggests that certain people respond to certain stressful life events by entering the sick role. For example, someone who is facing forced unemployment may react poorly and avoid the responsibilities by oversleeping, drinking alcohol, sick in bed. These actions are all illness behaviors. People sometimes turn to unhealthy habits and exhibit illness behaviors in situations that are incredibly stressful. And illness is one method of coping with unpleasant challenges, since people who are diagnosed to be ill cannot always fulfill the duties that a person with optimal health can. The society often would allow a reasonable amount of deviation in their behavior when they take upon the sick role. The second part is the stress and unhealthy behavior model. In this model, the person's psychological response to stress leads the person to unhealthy behaviors, such as cigarette smoking, alcoholism, and poor diet. The unhealthy habits places people at higher risk for various medical problems, and many of these behaviors are instigated by stress. The third model is the physiological stress and illness model. It links between stress and illness, as well as involves organic condition. It suggests stressful life events causes physiological or stress reactions, leading to organic disease conditions, and then through social reaction and definition, leading to illnesses. What is coping? It refers to interpretations and behaviors that people use to protect themselves from being harmed by new situations. Coping mediates the impact that stressors have on the personal health. To cope with stress, we can depend on either a problem-focused or emotion-focused approach when solving problems. Or we can attempt a meaning-making approach to re-establish life meaning and hope. We will further elaborate more in the coming slides. The role of cognitive appraisal is also essential in the process of stress coping. It depends on the thoughtful evaluation of two parts. The first concern is whether the event threatens the individual's short or long-term well-being. The second concern is whether abundant resources are available for dealing with the threat. There are two phases in the appraisal of the potential stressor. The primary appraisal involves the person's determination of whether the event is relevant and has any possible negative implications. For example, you may ask, what does the stressor mean to me? The second appraisal involves the person's determination of whether his or her abilities and resources are sufficient to overcome the threat of potential harm. The secondary appraisal is concerned about the resources that are available and easily accessible, including the motives, values, and abilities. The positive and negative appraisals are different. For example, from a positive view, the individual is confident that his or her resources can handle the threat. The individual would like to take it as a challenge and do the best for it, while the negative view is that people are not confident enough to face the threats. Another stress coping model is the homeostatic control model. It combines the unconscious and conscious parts to achieve subjective well-being. The unconscious part, the individual's personality, provides a steady and sufficient background that determines the set point range for the whole homeostatic system. A set of cognitive buffers involving perceived control, like optimism, self-esteem, or control, absorb the impact of different need states and together with personality, create subjective well-being. There are some external buffers from the surrounding environment as well, such as money and relationship. Those met and unmet needs act directly on the cognitive buffers. The met needs to reinforce the buffering system, and the unmet needs to provide motivation. Both of them contribute to subjective well-being. Coping efforts fall into two major functional categories: problem-solving efforts and emotion-focused coping efforts. Emotion-focused coping involves attempts to regulate or reduce the emotional consequences of stressful events. The individual attempts to control the emotions. In response to stressful events, the emotion-focused coping response may also involve cognitively re-evaluating the situation, seeking emotional support and reassurance from other people, trying to accept the problem, and discharging emotion. Problem-focused coping suggests taking direct action to change a stressful situation or to prevent or reduce its effect. The goal of problem-focused coping is to reduce the demands of the condition or enhance one's resources to deal with it. The last one is meaning-making coping. It is a way that we try to make meaning of our situation in terms of our values or beliefs. Let's use an example to illustrate the differences between these three. For example, Jack is facing a strict examination next week, and he feels very stressed out and depressed at the moment. If he is a person with problem-focused coping strategies, he will take actions such as reviewing the learning materials as soon as possible. So what if he's an emotion-focused type? He may take a rest, let himself feel relaxed first, and ask for emotional support from his classmate. If he is good at meaning-making, he may consider this examination as a test for his knowledge instead of getting a good grade. Those are the differences between the three types of coping. What is your coping style? We often have strengths and resources that come to support us to cope with stress. The first dimension is an intrapersonal or internal strength. It focuses on the individual's characteristics, namely biological, psychological, spiritual, and relational aspects. Coping with stress can sometimes be achieved through direct biological means. Examples of appropriate behaviors are running and meditation. These various behaviors attempt to encourage a different physiological reaction in the individual from the usual fight or flight response. Relatedly, feedback techniques provide control of physiological arousal resulting from the stress. Psychological coping mechanisms basically involve efforts at controlling meaning. That is, specific interpretations can be used to neutralize the effect of the stressful life event. For example, the individual can learn to think in particular ways to make the stressful life events less essential or less traumatizing. Spiritual power, such as values and beliefs, can also support you. The last one is social or relational resources. It is your network that can help you solve the problem. If you maintain these good habits and resources we mentioned above, you will be better prepared to face the stress in your daily life. Apart from internal strengths, the external environment would also supply different resources. It may come from your significant others, such as friends, family members, or even the society. Some researchers also proved that social support would sometimes be a buffer between stress and illnesses. An environment with high collective efficacy, cohesiveness, inclusion, and integration will be less likely to evoke conflicts and disharmony that would cause stress. The power of social support is greater than what we expected. It can help prevent illness. People with high-quality social support may have a more effective immune system to fight off major and minor health problems. Social support may change the physiological reactions in the body. Also, it is a reliable assistant when coping with illness. Some researchers found that people with higher social support often recover quicker from the illness and are better at dealing with it. What's more is that those who have a better social network and social support will have a longer life expectancy and better quality of life. The buffering hypothesis and direct effects hypothesis can explain these links between social support and health. According to the buffering hypothesis, social support provides a buffer from daily life stress, which in turn protects people from negative health-related consequences of anxiety. Direct effects hypothesis claims that having high levels of social support is always advantageous to health, regardless of the level of stress. Which one do you think is more reasonable? Instead of facing the stress directly, we sometimes use our defense mechanisms to avoid the challenges. These are the usual unconscious responses we have to deal with stress, usually determined depending on what the stressor is, our personality, and what support is available to us. Some ego defense mechanisms to stress are denial, projection, representation, reaction formation, regression and fixation, and displacement. Someone may think it is a useful way. However, we should know that defense mechanisms grant short-term release but cause long-term problems. Guess what is the most common stress coping method applied among Hong Kong citizens? Most people choose to do exercise, talk to somebody, entertainment, and rest as the way of coping with stress. The emotion-focused coping strategy is more popular and seems to be more useful in Hong Kong, and the citizens make full use of their internal and external resources. Referring to this set of data, we also find some gender differences. Women prefer to talk to their friends, eating, and shopping more than men. What do these results tell you? Does this provide any inspiration in selecting which type of event to cope with your stress?